South Africa is reportedly facing a talent flight in doctors and medical professionals because of the National Health Insurance Scheme. The NHI is designed to pool funds to provide access to quality, affordable personal health services for all South Africans. For a view on why this is happening, we're joined by the Chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, good evening and welcome to the program. Thanks for your time. So you've got 12,000 medical doctors in South Africa. Of course, you represent their interests. They've shared the sentiment with you. How imminent is the threat of them going? We'll talk about the reasons why in just a moment, but do you think it's real and it's possibly going to happen very soon?
Good evening to you, Iman, and your viewers. Thanks for having me in your program. I think it's not a threat. I hear people calling it a threat. It is the feeling of doctors on the ground. And when we're talking about doctors leaving the country, we're talking about something that is continuing. It might be exacerbated by the introduction if the NHI is not altered in the way it is presented now.
All right, so it's already happening. It's just going to accelerate. You're saying likely, you know, if this comes into full effect. So there was a survey that the South African Medical Association did showing that as many as 38% of its members planning to leave South Africa due to the planned introduction of NHI. But there was also some interest. There were some interesting other reasons as well why people wanted to go. Please share those with us.
Well, most of the reasons that were shared by our colleagues on the ground when we sought their feelings was that you know, they don't have confidence in the management of the healthcare system. I mean, they were worried about how on earth you could give you know, such a responsibility to one person, the minister. We thought that there was so much, a lot of power that was given to the minister alone. And we said at that time, we are not talking about personalities. We are talking about the office of the minister. It cannot be given such powers, you know, in the bill as it stands. And but also other issues are you know, how the system is being run. There's a dire shortage of doctors on the ground, and you know, there's unnecessary freezing of posts. As we speak now, most provinces are not training registrars, so there's no hope for specialists, you know, to continue being made available to the public. But the most important one is the fact that patients are going to suffer a lot if, you know, we allow, you know, the policy to just go on as it is. It is our duty, Iman, to question the you know, any policy that is health related. We are not apologetic about that. We need to be engaged. We are an important stakeholder when it comes to that introduction, not only for the interest of doctors, but for the interest of patients as well that we are treating on the ground.
Possibly some good ideas, I think you're suggesting there could be lost or missed from the very pool of people that are meant to bring their skills to the table with NHI. The Department of Health is talking about this framework that they have in place to turn the ship around, is the phraseology they used. Are they including doctors enough? I mean, they are a key stakeholder in the success of this plan or not. Do you feel, you know, sidelined overtly, and should you be playing a far more vocal role?
Well, we have made our submissions. Each time there's a white paper, there's a green paper, whatever is, you know, we meant to contribute. We've made contributions, you know, since 2011, and we've been consistent into pointing out issues that we are not happy about. I must state this, Iman, that we support what the World Health Organization called the universal health coverage. But South Africa has chosen the NHI vehicle. Our problem with NHI is that it only addresses the funding. You know, it's a financial model. It forgets about any other thing, that, you know, the mismanagement of the, you know, of the healthcare system. You know, it does not talk to the issues of human resource. it does not talk about health and safety and all these things that must be addressed in the workplace. So you cannot just on one thing, on the financial aspect, hope that you are going to turn things around. It must be a very big ship to turn around, because they've been singing that tune that they are turning it around. We don't see any turning in this regard.
So I think it's important then to state for the record that this is not, anti a plan that makes access to universal health care available to everyone. What it is opposition to this particular plan in a context like South Africa's.
Yes, we have pointed issues even on the NHI bill, because the perception out there is that SAMA is opposing the whole bill, which is not true. We have pointed issues, like I said earlier on, that we felt that, on the issues, on the issue of the minister, they've given too much powers. And we know that South Africa is engulfed in corruption. And we needed to make sure that if you are going to pull such a huge fund, there are processes in place, to guard that fund. It must be ring-fenced. I mean, in other countries, it's a criminal offense, to be tapping on health resources in that route of corruption. Yeah. We should be employing the same thing. The president of this country and the cabinet, the whole government, should understand that if you're taking away, you are stealing resources from the communities. Those people are going to die, because they are meant to be held up by those resources. In fact, it's murder. You are killing people if you are stealing from the public purse that is meant to help the healthcare resources.
And concerning issues you're raising there, I think I want to, just share as well with our viewers some of the other sentiments Summer is sharing, that, the focus should be on fixing the public sector. And we can see in different, in different provinces, in different hospitals, the high level of, dysfunction. And once that kind of rehabilitation is happening, it would begin to, reinstill confidence that on a national level, a plan such as this has bigger prospects of succeeding. What we do know, Dr. Mzukwa, is that you cannot have NHI without doctors. And you can't have every single doctor, I suppose, leave South Africa against the backdrop of where we don't already have enough medical skills. So what's the way out of it for us right now?
You only need a listening ear. If you are going to use your ego to, forge your way forward without listening to the concerns of the people who must make this bill or this policy to succeed, I think we are going to have a problem. So what we are pointing out, we are working together with government to say, government, no, we are not happy on these issues. Work on these issues. If we have a listening ear, we can get out of many problems that we have today. Like the issues that you pointed out now, the issue of public hospitals. I know private hospitals have got their own problems, but we're looking at what government is doing now, in terms of the public hospitals. How messy the hospitals are. Recently, look at the Charlotte Maxeke Hospital. How long does it take to fix a hospital? In China, in a space of days, they built up a hospital. In South Africa, to repair a hospital, it takes years. So how can we trust you if you are failing to repair just one hospital in the whole country? How do we trust you that you are able to make sure that all other hospitals are running smoothly and the whole healthcare system is stable and it can deliver the services that are so needed by communities?
Well, this certainly needs a lot more agency and urgency, and thank you for sharing and providing more clarity on the story for us. Dr. Mvuyisi Mzukwa, who's the chairperson of the South African Medical Association.